Hi, this is Jim. It's the middle of the week, Wednesday, July 22nd, 2020. And here is your COVID 19 metrics update for Georgia for today. Today, much it looks a lot like yesterday. Pretty much hit the carbon copy on what's been going on from a testing and cases perspective. I'm going to go ahead and pop that up. And we'll start off with tests and cases. We've been seeing over the last few days a drop in testing volume. Last week we were seeing testing in the 25,000 range. This week it's been more like 21 to 23,000. So you can see there it was 3,100 off of last week. And that seems to be having an impact on cases because we're still seeing the same, if not a slightly higher positive rate. So cases are coming in around 3,300, 3,400 the last couple of days. I'm believing that the totals are really being constrained on cases by the volume of testing. Now, I don't think that's intentional. I just think it's as we get more cases, we get more backlog, and we can only process so many at one time. Looking forward to seeing the new capacity that the governor mentioned the other day come back online. So keep our fingers crossed that we're going to be able to start testing 30,000 a day or so in the next week or two. Let me go on to the death report for today. We actually had 81 deaths reported today. That is a second highest of all time. We had a 100 death report back in April, and then we've had a couple in the 70s, and I showed that chart yesterday if you want to go back and look at that. And I made the comment yesterday that I felt like some of this was a recurring data dump, and one of the users, one of the Reddit users, Siddhartha, posted that he found a quote from a Department of Public Health spokesperson that said some of it is a data dump and just a backlog of getting these deaths reported. But they also said that some of it is actually driven by this increase in hospitalization. And if we think about it and look at the case trend really starts picking up July 1st. It's July 22nd. That's 4 weeks. That's 3 weeks ago now. So I'm not surprised that we're starting to see the deaths rise. Feels a little more extreme than I would expect. I was expecting more of a slope up, kind of as we've seen on cases and hospitalizations. So something to watch out for. You know, it's 2 days at this point, a little soon to call it a trend, but it has driven the 7-day average up about 10 a day over the last 2 days. So we'll definitely keep a stronger focus on this over the next few days and week or so. Active hospitalizations was updated. We had yesterday was a down day. We had another day, unfortunately, of it going back up. So the 1 day decline didn't last. We went back up to 3180, just below the high that we've been watching from a couple of days ago. Hard to say if we're starting to get into the decline after the peak or not, because of the concern of, as I mentioned, the lower testing. We're at least maybe could think about being at a plateau. I think it's too soon to tell after only 3 days. Remember, last week we had that big Friday that really jumped out at everybody. So we'll see if we have that again this week. The other thing that I normally show is the GEMA CCU report. That was not out by 4:30, so I'm not able to show it today, but we'll catch it up tomorrow, and we'll at least give you the Wednesday numbers, if not the Thursday numbers as well. I did want to go ahead and show one other report, though. Let me change things up here. One of the things that I'm trying to update once a week now are how we're doing against the White House metrics. So it was reported about 10 days ago that there are two metrics that the White House is looking at, and they are classifying states by. Those are cases per 100,000 residents as far as a 7-day average, and then positives on COVID-19 tests. So, looking at the cases per 100,000 residents, we are more than double over the red line. We hit 250 the other day, just slightly coming off of that. Though the red line there is 100 cases per 1,000 residents. And then if we want to get into the yellow range, the yellow is between 110 cases per 1,000. So we've got a long way to go to be out of red or even yellow zone on this metric right now. It's in fact, if you look back, we really haven't been out of the yellow on this metric since March. So while we flatten the curve here, the curve's no longer flat, and I think we would be lucky to get back into the yellow at this point in the short term. The other piece to show here is positive percent of positive tests. We've talked about this a few times online in the Reddit chat, but we may not have talked about it on the video specifically. So the people who look at the data, the pandemic people, CDC, those kind of people, WHO, say that really in order to have a decline in your cases and have a more stable, less impactful infection rate, you really need to have your tests be only about 5% of your total, 5% positive. And so if you take a look at this chart, you'll see the red line here is 10%, and we are certainly above it. We're running right around 15%. There's a yellow line that's at 5%, and we dipped slightly below it, but I don't want to say, wow, we had it all under control in March. I think there was definitely a trend in the right direction because we had some beneficial, we were in that period where we were sheltering in place through the end of April. We started to open up in May. Things were continuing to decline because there weren't as many people out there with COVID, so it made it harder to catch. But then, as you can see, starting in June, everybody went out for Memorial Day and said, all right, it's all done, take off your mask, and away you go. And that's now why we're seeing the spike that we're starting to see today, because it just passed on and passed on. The reason that you see that yellow, that the pink line dip below the yellow line there, is there was a period of time when the Department of Public Health was counting antibody tests as part of total tests. So we're not able to separate that data out, and that artificially moves that positive rate down, beginning why you see that kind of lift up right there at the end of May, early June, is that they stopped and started to separate that data out. We could then compare the positive rate to the actual number of new cases, and that helped us get a better understanding of what was going on there. So we've been in the red before. We were out of the red and into the yellow. Now we're back up into the red, and hopefully we will get that down soon as well. So that's what I've got for you on this Wednesday. As I said, I will continue to watch for the GMA data and update that in tomorrow's thread. Feel free to go on to Reddit, post any comments. Always glad to hear thoughts, and they inspire my ideas to come up with additional charts like the one that I just showed with the government total. So let me hear what you have to say, and we will talk to you tomorrow. Thanks.